At the heart of this debate is very simple. Who should decide when or whether a woman should start or grow a family? I believe the answer is clear. Women should be trusted to make the decisions about their own bodies, their own futures, their own families with the people they trust. And let's be clear what Weldon and Hyde do. The Hyde Amendment denies millions of women, especially women with lower incomes, the ability to make their own reproductive health care decisions simply because they rely on federal health care coverage. Hyde creates a two-tier system in America, one where people with money can access a full range of reproductive care, and another where women struggling to pay rent, to buy food, support their families, are denied that same freedom. A woman's ability to decide whether or when to start or grow their family should not depend on their income, should not depend on her zip code or their insurance card in her wallet. A mother working two jobs, a woman serving our country, a family already facing impossible choices should not have fewer options because politicians decided that only those who can afford it can get care. And the Weldon Amendments take us further down the wrong path. It actually allows healthcare institutions to put their own ideological policy ahead of a patient's needs, restricting access to abortion care, coverage, information, referrals, and even when a woman is facing her hardest moment in life, a moment that calls for facts, that calls for compassion, it calls for medical care. It doesn't call for politicians standing over her shoulders. Hyde and Weldon are out of date, out of touch with the lives that women lead today as mothers and grandmothers, caregivers, members of our military, and breadwinners for their families. These provisions do not protect life. They block access to health care. They deepen inequality. They silence medical judgment. And they take important personal decisions away from women and the people they trust and put the politicians in charge. So let's get back to where we started. Who should decide? Who should decide whether a woman is ready to start or grow a family? Who should decide whether a mother can safely continue a pregnancy? Who should decide what is best for a family facing the most personal and painful moments in their life? The answer should not be Congress. It should not be politicians. It should be women with the people they trust. And I yield back. This bill would have real and painful consequences to the women and girls of this country. In fact, some might say this is a war on women and girls. So when a woman cannot get a cancer screening, when she cannot get access to basic health care, when she cannot be in charge of her own personal health care decisions, the impact does not stop there. It affects her children. It affects her family's financial security. It affects the health and strength of the entire community. And yet this bill eliminates or dismantles programs that generations of women have counted on to stay healthy, control their own health care decisions, and build better futures for themselves and their families. Let me count the ways. First, this bill completely eliminates Title X. For more than a half century, Title X has stood as the nation's premier bipartisan, I want to stress that, bipartisan family planning program, helping millions of Americans access contraception, cancer screenings, STI testing treatment, infertility services, and other basic preventative health care. The bill takes away all $286 million from that lifeline. To me, that is crazy. Think what that means in real life. Imagine a mother of two working hard, doing everything right, but barely making ends meet. She depends on an affordable clinic for her health care and the ability to plan her family's future. Without access to contraception or basic care, an unattended pregnancy can mean impossible choices. How does she keep working? How does she afford childcare? It goes On and on. How does she provide for the children who already depend on her? Or imagine a woman whose doctor has told her that another pregnancy could put her health at risk. Access to contraception is not just about planning a family. It can be about protecting her health and her future. And that's the difference that these programs make, not in theory, but in everyday lives of women and their families. Next, this bill eliminates the Teen Pregnancy Prevention Program, a program that uses evidence-based approaches to help young people make safe, healthy, informed choices. Preventing intended pregnancy should be something we all agree on. Imagine a 15-year-old girl becoming pregnant before she has even a chance to grow up herself, a child facing the responsibilities of raising a child. A teen pregnancy can change the entire course of life for a young person. Young persons are more likely to experience pregnancy-related complications, face barriers, completing their education, and struggle with financial hardship. So why are we turning our backs on this? And the bill also eliminates the funding for Healthy Start that for more than 3 decades have saved lives and moms and babies in the highest risk communities with the care and support they need, improving prenatal care, reducing risk, and helping more babies reach their birthday. So why in the world will we cut this funding? And if it's not enough, this bill cuts funding for the Office on Women's Health in half. An office that's been focused on health issues that have been too long overlooked for maternal health, cancer screening, heart disease, mental health, and unique health needs that women face. This is it's dumb. Okay, I'll just say it very simply because I'm running out of time. It's dumb. And then the bill goes further, canceling $1 billion in research aimed at improving maternal health outcomes. At a time we're supposed to be doing more to keep women healthy, this bill does less. And listen, folks, our mothers and grandmothers spent their lives caring for us. The least we can do is to make sure that every generation now and after them have the care, respect, and support they deserve. I believe we can do better, and I hope as we will work together as this bill travels to support the women and families we represent. And I yield back.
I rise to offer an amendment to protect health insurance coverage for millions of Americans. Last year, the Trump administration and House Republicans passed the president's signature piece of legislation, the One Big Beautiful Bill, which cut Medicaid and nutrition assistance by $1.2 trillion. That bill will push 15 million Americans off their health insurance. And all of this just to pay for tax cuts for billionaires and big corporations. Republicans have voted to repeal or undermine the Affordable Care Act nearly 70 times, including refusing to extend the enhanced premium subsidies that help families afford health coverage on their own. Republican efforts to sabotage the ACA have already hurt families and small businesses, with millions of Americans dropping their ACA health plans this year, and millions of Americans switching to skimpier plans that have astronomical out-of-pocket costs just to stay covered while cutting back on basic necessities. The Trump administration and House Republicans are squeezing American families from both ends, increasing the cost of necessities, including health coverage, as they reduce the benefits in their existing health plans. Now, in this bill, the Republican majority is terminating $2 billion that is necessary to operate the ACA health insurance marketplace. The bill cuts $2 billion that supports families, small businesses, and individuals who need assistance enrolling in an ACA health plan, which, given the skyrocketing premiums due to the big, beautiful bill, people need more help now weighing their options. This bill is yet another Republican assault on health care coverage and the Affordable Care Act. By terminating $2 billion that is necessary to operate the ACA health insurance marketplace, it would jeopardize health care coverage for millions of Americans who are covered by these plans. My amendment would strike the provision in the bill that terminates this fund. It would restore funding to operate the ACA health insurance marketplace. I urge support for this amendment so millions of Americans will not be at risk are losing their health care coverage. I yield back. Once again, this amendment would protect ACA health insurance coverage for millions of American families. The Republicans have voted to repeal or to undermine the Affordable Care Act nearly 70 times. The president's signature piece of legislation, the One Big Beautiful Bill, is leading millions of Americans to losing their health plans. In this bill, Republicans have cut $2 billion from funds to operate the ACA health insurance marketplace. This cut would jeopardize ACA health coverage for millions of families. The amendment would remove this attack on the Affordable Care Act. It removes the attack. It's just not on it's on an act, but it is about an attack on Americans' health care. And you will have to explain to your constituents why you voted to just allow this to go forward, and why you would continue to allow their health care costs to go up. And I don't know how understanding they're going to be about this. I suspect as earlier on they will be less than understanding, but those are the consequences that you will have to deal with. I yield back. The radical supermajority on the Supreme Court's ruling overturning Roe v. Wade was not about protecting life. It was all about stripping agency and dignity away from women. And that has been the result of the Hyde Amendment for decades. When Medicaid covers the cost of pregnancy-related care, including abortion, it means patients can make informed decisions. Currently, 30 states and the District of Columbia, though not by their choosing, deny state funding to women seeking access to abortion. As a result, millions of women in these states are hostage to their geography. With the radical Supreme Court decision, it is more important than ever that we act to empower all women to make these decisions. This amendment also strikes the Weldon Amendment, which prioritizes a health provider's beliefs over a patient's health needs. It gives power to determine women's health choices to institutions, insurance companies, hospitals, or any kind of healthcare facility or organization, rather than leaving that decision to a woman. The Weldon Amendment has been used to block efforts to expand abortion coverage by threatening critical federal health dollars. If this debate was truly about protecting life, every member in this room would vote against this bill. It cuts funding for public health, reproductive health, education, job training, and more. But the interest in protecting life doesn't seem to extend beyond pregnancy. Arguing that these riders have been law for decades and therefore we are prevented from making changes is disingenuous. The activist Supreme Court disregarded science and decades of legal precedent and the will of the majority of the American people to strip away a woman's fundamental and constitutional right to make her own health decisions. The decision to get an abortion should be made by a woman and her family in consultation with her doctor and in accordance with her own faith. I urge my colleagues to support this amendment, and I yield back.